COVID-19. I want to bring in now Professor Lynn Morris to help us do just that. She's the Interim Executive Director at the National Institute for Communicable Diseases. That's just one of her many titles. Professor, it's a great pleasure having you on the program.
Thank you very much for the invitation.
Look, as you know, we are not only fighting a pandemic, but we're also fighting an infodemic. So we need all the help we can get in trying to understand this virus. And I just want to remind our viewers that they can call in now and ask the good professor some of the questions you may have about COVID-19. That number is 078 799 4480, 078 799 4480. Professor, I want to start off by talking about how this virus spreads. We know that coronavirus spreads from our respiratory tract, and it, I guess, hitches a ride on these droplets, which are of all different sizes. Do we know what proportion of the virus rides out and infects others? From what size droplets?
Yeah, no, it's a very pertinent question, and we don't completely understand the transmission of this virus. Certainly the bulk of infections are through droplets.
Right.
So those are, and they do have a size, so it's 5 microns. They're very small, but they are large enough that they also fall to the ground quickly. And so that's what, the bulk of the transmission is through droplets. So droplets would be spread when somebody coughs or sneezes, and they obviously then, would, potentially land on somebody else.
Right.
And that's really why it's so important to, for the social distancing, and also for people who have symptoms, for people who are coughing and sneezing, to wear a mask.
Right.
Because that's a physical barrier to stop those droplets coming from, somebody's respiratory, from the back of their mouth, from their nose, coming out and infecting somebody else. So certainly that's most of the transmissions. There are indications that the virus can also be spread in other ways through aerosolization. So that's really a fine mist. So that's much, much smaller particles that can hang around in the air. Now, that is really something that's being studied. Certainly we know it's a big risk for healthcare workers.
Yeah.
So people who, especially, doctors and nurses that are ventilating a patient, that process of ventilation actually creates an aerosol. And that's why, healthcare workers really are at an increased risk, and why they need to, practice very safe procedures and wear protective equipment.
So let's talk practically, Professor. Take, for example, a person merely saying, "Good morning, how are you?" Have we measured how far these droplets can actually travel by a person just speaking?
Well, so, there have been studies done in labs, and we have to be very careful about studies done in labs because, that doesn't simulate what's really, going on. But, there are indications that the virus, can hang around. There's a publication very recently to suggest that it can hang around, for under laboratory conditions, for even up to an hour. But that's, as I say, that's under very controlled conditions. And I think what it really speaks to is why we need to keep away from each other, because of these things, and why we need to, practice all the things that we know, wash your hands, and if you do have symptoms, wear a mask. So it really speaks to, I guess, and you were talking about misinformation, there is a lot of misinformation, but the other thing is we don't have all the information either, because this situation is evolving so rapidly, we're learning as we're going along. So advice does change over time as well, and people need to keep up with that, and that's why your kind of programs are very important, and why people also use reliable sources of information.
And there's a humility in that, isn't it, where the experts are learning every day.
Absolutely.
If let's take another practical example. If I'm walking outside, or singing, or whistling, or coughing, and somebody walks behind me, let's say 30 seconds later, is the virus still in the air? Can they catch it?
So, there have been cases. There was an example in a church where there was people singing and there was some transmission in the church. So, these kinds of things could potentially happen. Yeah. They are not, however, and I think this is what's important. They are not, however, the major route of transmission. The major route is really droplets, so from people who've got symptoms. And so that's why it's also important to stay away from people who are coughing and sneezing as well.
I
generally,
understand.
Social distancing will get around this issue as well of aerosols.
So I understand that when you are outdoors, these tiny aerosols dilute pretty rapidly in the air. So I guess that's why it's so important for our healthcare workers to fully protect themselves when they are dealing with coronavirus patients in a room.
Absolutely, because they're also leaning over the patient. They're in a confined space, and that's why being outdoors is also obviously is a good way of of avoiding these aerosols in closed rooms. Yeah.
Does the level of exposure, Professor, to the virus determine how sick you get or how severe the symptoms will be?
Yes, so that's a very critical question because there's a huge range of clinical symptoms with this virus, and including many people who don't develop symptoms at all. And there's I'm sure everybody knows, there's a strong age association with more severe disease because of, and I heard your previous speaker talking about, underlying conditions. So yes, there's a huge range. Again, we're still trying to understand that. We do understand some things. Obviously, if impaired lung function is a huge risk. But yes, why some people can get infected and not even know they're infected is obviously very intriguing and something we need to understand better. Yeah.
Professor, we did say that we're going to take some calls. A lot of people have a lot of questions with regards to COVID-19.
Sure.
So the number to dial is 078-799-4480. We understand we have Tiniko from Guyana. Tiniko, a very good morning to you.
Good morning. How are you, sir?
I am good. What's your question to the good professor?
I have a question to Professor Lynn Morris. What is the risk of SARS voluntary infection in humans?
Just repeat that. I just missed that as well. Sorry, Professor. Just repeat that again to Nico.
Hello, can you hear me?
Yes, I can. I think you're too close to the receiver, but just go ahead and give us your question again.
Oh, okay. I was asking, since people are saying this coronavirus is spread through droplets, what if a person is wearing a mask and then those droplets fall on the mask? Will they be infected?
Right. Okay. I guess so. So general use of masks, Professor. I mean, we are being encouraged to use them. The conventional wisdom is that masks protect the user to a small degree, but really protects others.
Yes. No, it is a great question, and it's one of the areas that is evolving. The thinking around masks is definitely evolving, and so so masks are a physical barrier, and so definitely if you're coughing, you would cough into the mask and prevent the spread. But if you're somebody who's wearing a mask to protect yourself, and somebody does cough on you, then those droplets could be on the outside of that mask. And it is very important then when you take the mask off that you don't touch, the outside of that mask, and then almost self-inoculate. So actually the wearing of masks is also critical. And to be honest, it's one of the reasons why there's been some reluctance to encourage normal people to wear masks, is because they are uncomfortable. People do fiddle with them and touch them. If the mask does contain some virus and then you're touching your face, which is of course something we're trying to encourage people not to do. But I think if people wear masks and they wear them properly, it's definitely something that is recommended for healthy people, yes.
Yeah. Nico, thank you very much indeed for that call. And, just to add on to that, the N95 masks, which are needed by the healthcare professionals, I understand it stops around 90% of these tiny particles. It's so important for our healthcare workers. So the rest of us shouldn't be using those type of masks, we should be using the cloth type.
Yes.
Correct.
No, absolutely. So the N95 masks are for healthcare workers, for people dealing directly with infected patients, because those masks have to actually be fitted individually. Not anybody can just go and get one. They have to be fitted properly so that they're tight around the face. And so they're really only recommended for healthcare workers. The surgical masks are which have sort of a filter or a gauze. They are recommended for people who are infected. And then the cloth masks are recommended for, uninfected, for the general public.
Right.
For the non-medical masks, yes.
Professor, we have Sipho from East London. Sipho, very good morning to you.
Good morning. My question is it true that when a person gets healed from the coronavirus, they cannot contract it again, like they become immune? Is that true?
So if a person contracts COVID-19 and they recover from it, Professor, can they get it again?
So that is, again, a fantastic question, and we don't know the answer to that. So we know from other viral infections that antibodies protect against reinfection. That's how our body protects us. Is it develops an immune response, and then we basically don't get the same disease twice. Mm-hmm. It's also the basis, of course, for vaccination. To develop those immune responses. Now, certainly for other coronaviruses, that's certainly the evidence suggests that is also true. And, we're working on the basis that it will be true for COVID-19 as well, that once you have been infected, you won't get reinfected. However, I should say we do not have the evidence for that.
Right. So these antibody tests to see if you had COVID-19 and you have recovered from it, it shows us, I guess, some sort of immunity after catching it. How far are we from it in terms of getting those tests?
Yes, so antibody tests are coming onto the markets, and they're non-licensed yet in South Africa. And I think we also need to be very clear about the role of antibody tests, because they are not useful for diagnosing infection, so people who are currently infected. But they're very useful, and they will become more and more important as our epidemic progresses, for detecting people who were infected and who may be immune. And so, yes, they will become more and more important, and we're certainly seeing them being used now in other countries. It's very literally in the last week there've been reports of them being used in the US, and certainly in South Africa we will be using them going forward. But again, just to stress, it's they're not sensitive enough to pick up a new infection.
And
it's for the
I hear you, Professor. And, we talk about learning things every day with regards to this virus. I was just looking at a report coming through, and there's research with regards to when are you most contagious. And some are saying now, certain research, experts are delving into this, is that it's before or during the first week of symptoms. What have you heard with regards to this?
Yes, so that is another aspect which you actually measure the amounts of virus, or called the viral, or your ability to shed the virus, or your viral load, and that does vary over time. And certainly in the first few days, the virus levels are higher, so people are more contagious at that stage. And of course, if they are coughing, they are then spreading that, that virus around. So yes, so very important. And again, it's really stressing about the isolation of confirmed cases, really limiting interaction of people during that highly infectious phase.
Yeah. So what's the latest data talking to with regards to if you're asymptomatic? How contagious are you?
Yes, so that's also a great question. There is indication that that they are contributing to the transmission. How much they're contributing, we still need to figure out.
Yeah.
And that's really, again, why we all need to be practicing these measures, these interventions, these behavioral interventions, because we don't know who's asymptomatic, because it isn't possible, to go and test everybody. And so at some level, we all just have to assume, that we are, a source. And so that's why we all need to practice these social distancing measures.
Prof, we've been asking our viewers as well to send us some tweets with regards to the questions that they have. Before I take a tweet, I want to get Lesedi. Lesedi's on the line. Lesedi, very good morning to you.
Good morning, sir.
What's on your mind? What's your question?
I would like to ask if are we really gonna go to school this year since this corona epidemic is spreading too fast? Like, are we gonna go to school?
Yeah, I'm not sure if the good professor can answer that one.
Yes,
Prof,
no.
if you want to get us take a stab at it, but maybe talk in general terms of where are we in the fight against COVID-19 in South Africa?
Yes.
We've done over 100,000 tests now. You know the numbers have climbed up to over 3,000. I guess it will depend on where we are at the end of 2 weeks.
Absolutely. So as we all know, the lockdown has been extended, and the situation is being evaluated. Certainly from what we see in other countries, in some countries, there's been an easing of a lockdown. Yeah. Other countries have actually had to reinstitute a lockdown. So, it's also going to depend on the information that comes through from the community testing program, so we get a sense of how widespread the virus is. So at this stage, it's not clear. And obviously, you're right. I mean, those are questions that I'm not, privy to the answers. Yeah. That really are made at a very high level, by our government.
And with regards to, community testing, we understand that close to 900,000 people have been screened so far. And out of those, 11,000 have been referred to for tests. And we told yesterday from the health minister, 52 out of those 60 mobile testing vans have been deployed so far. So this approach is not waiting for people to come for testing. It's going out to the community.
Absolutely.
And screening them and subsequently testing them. We've got Lucky from Soweto. Lucky, very good morning to you.
How are you, Blame? Are you with Professor Day?
Very well, Lucky. What's your question to Professor Morris?
Yeah, no, is that I'm quite concerned. Thanks for the opportunity and the viewers morning. Is that what the government seems like is slower in contaminating this virus? Because look, Soweto and Orlando West, for an example, practically next to Mandela. Here in Soweto and Orlando West, it's 99.9% of tourist visits. So now the quarantine that is been applied is not visible. That's number one. And number two, the other thing is that with education, we have school governing bodies. Why don't you come up with a what you call, it's not lucky, not because nothing noble. Now what is happening is that with the schools, the schools are losing. Why can't you come with a volunteering of the school governing bodies, have a permission to assist the parents in their homes, and then we have the curriculum that can be pushed, and then and because we are pushing the dull youth that will be going to another grade, that'll be a big debate. Thirdly is that the economy, how post this virus, how people are going to survive, because open space are not being cultivated on agriculture, and people will be fighting for food because of poverty.
No,
we are doing environment. Our environment is not conducive. It's very, very dirty. I want to hear from the professor. Thanks, Blame.
Thank you very much indeed, Lucky. Again, Professor, I'm not sure if you can tackle this. I guess if we look at it from the point of view of the health world and the economic world at loggerheads, and people are asking, can we open up the country incrementally as things improve? As a medical professional, what would you say to that?
No, I mean, I completely agree that the consequences of the lockdown are severe and need to be taken into account when these decisions are made. And I'm certain that they will be. And you're right. I mean, these are not things that I can address. But yes, there's no doubt that And it's not just, I mean, obviously, people's immediate needs are important, but also there's implications for other health programs, immunization programs. We don't want to be seeing a resurgence of measles and rubella and other things because programs have stopped. We also, people who need healthcare for other reasons might be neglected. So, there's a real knock-on effect. Yeah. But I think the thing about a lockdown is it's supposed to be a short, sharp period in order to buy some time, which is what it's done. It has bought us some time. Yeah. We've kept it under control for this short period of time, hopefully, and that we can be more effective, when later on.
Prof, I've got a tweet here from Letladi, and he was asking, we're raising a 4-month-old baby that we obviously can't avoid contact with and even apply social distancing with. So as a couple who's not sure about our COVID-19 status, how do we best protect that innocent soul from infection? I guess it's a parent's concern. All parents are concerned about this. What's your advice, Prof?
Yes, of course. But, sort of social distancing is really between families. So within families, obviously, it's a very difficult thing to practice. And I guess it's when the parents are out and about, it's that they really are very stringent about about staying away and from crowds and other people and washing their hands and all those things. But I think I should also just add, that COVID infection in children is quite mild.
Why is that though? Do we know why?
No, so certainly in older people, we do know that their immune response is not quite as in fact, it's an over response in some cases. There's an inflammation in the lung, and they basically can't control the virus, and so the virus, it basically causes this massive inflammation. So there is something about an older immune system. And again, as I said, things we don't understand, but also, this link with these other conditions that predispose, people to having severe disease. So having lung damage, it means you can't fight off the infection effectively. Yeah,
and that's why it's I guess concerning when certain drugs are mentioned, like chloroquine. We're hearing about remdesivir now, which was designed to fight Ebola. When you hear about these various drugs that are being put forward as possible treatment for COVID-19, from this point of view, from your point of view, what's showing promise at this stage?
Yes, so it's also a great question. So right now there are no licensed drugs for coronavirus. The one that is showing the most promise is, as you say, is remdesivir. So this is a drug that was developed for other viruses. So, viruses have some common ways of working, and this inhibits a particular process in the virus life cycle. Yeah. And it was not shown to be effective in Ebola. That was also because they only started testing it towards the end of the Ebola outbreak. But certainly in the lab, this drug shows promise against this particular virus, SARS-CoV-2 it's called, that causes COVID-19. Yeah. So it shows effects in the lab, and now there have been one published and one soon-to-be published study showing that it does have benefit in severely ill patients. And so it's going to be tested formally in a proper clinical trial, and South Africa is part of that trial, so we will be having access to that drug to test it. Yeah. But right now it's really used on it's available on compassionate use. Yeah. Because it isn't actually licensed. But yes, I think it is. There's certainly drugs out there that. And then there are a number that people are testing. So these are drugs that are basically being repurposed in a way. They were developed for other things and are being repurposed. So we know that they're safe, which is also, a good aspect because they have been tested in humans before. And there's going to be a lot of other drug development going on, to try and specifically target this virus, in addition to vaccine development as well.
Prof, just before we go, I just want to ask you one final question. Many essential workers are using a lot of hand sanitizers, alcohol-based hand sanitizers, because, soap and water is not always available, say for instance where we are. We often inhale a lot of this hand sanitizer. Sometimes we use it in the car with the windows up, and you inhaling these fumes. Should we be concerned about that with regards to these hand sanitizer fumes?
Okay, well, I have to say, it's a smell of alcohol. It would just be the smell of alcohol, which would disappear very quickly, that is definitely not going to cause any harm. But obviously, one doesn't want to overdo it. To use a little bit and to do it in an open space and I guess make sure it dries as well before you start touching things.
Professor, thank you very much indeed for your time and coming on. We no doubt will get you back on the show. You're imparting your knowledge and wisdom here, and we'll need your expertise coming here and separating fact from fiction. Thank you very much indeed for your time. Be well.
With pleasure. Good night. Good
All
day.
right. That was Professor Lynn Morris there from the NICD. She's the Interim Executive Director at the National Institute for Communicable Diseases, Professor Lynn Morris. We're going to take a quick break. I'll get you more news next.